This is All India Radio Mangaluru. Dear listeners, in today's Talk in English program now, Dr. Shashidhar Acharya, Professor, Department of Public Health Dentistry, Manipal College of Dental Sciences, MAHE Manipal, will speak on the topic Non-Nutritious Diet and Oral Health.
The mouth is the gateway to the body. A healthy mouth is essential for good health. Among all the factors that can affect oral health, diet and oral hygiene are the most important. Today I will speak about the role of nutrition and the impact of a non-nutritious diet on oral health. Our diet can be classified as three things: non-processed, fairly processed, and highly processed. Non-processed diet consists of fruits, vegetables that have natural sugars and a high fiber content. Moderately processed food are the food that we most commonly consume, like idli, dosa, roti, breads, etc. So these are called as moderately processed. Highly processed foods are foods that have high amount of calories, fat and salts, etc. like chocolates, pizzas, burgers, chips, aerated drinks and so forth. Dental diseases are often called as diseases of civilization. The disease becomes more common as civilizations progress and modernize. The diet changes from basically non-processed to highly processed food, which is bad for oral health. Numerous studies have been done where the caries levels suddenly increased once there was an introduction of the Western diet. Many studies have been done in islands which previously had a very basic diet, and because of Western influence, after a few years, we found that the prevalence of caries increased a lot. Dental caries is the most common dental disease worldwide, and surveys have found that more than half of India's population suffers from dental caries. Among the various causative factors, carbohydrate consumption is an important nutritional factor in the development of caries. The relationship between carbohydrates and dental caries depends on the types of carbohydrates consumed, because the potential to cause dental decay are different for different types of carbohydrates. Among all carbohydrates, sugars are considered to be the most important cause of caries. The term free sugar includes all sugars added to food beverages as well as naturally occurring sugars found in fruit juices, concentrates, honey, and natural syrups. In addition to the type of sugar consumed, the amount consumed may also affect caries development. Higher incidence of caries is found in countries where sugar intake is greater than 10% of total energy intake compared to those with the sugar intake of less than 10%. Frequency, or how often the sugars are consumed, may also play a role in caries development. Increased frequency of sugar consumption and additional snacking between meals have been found to be an important risk factor for dental caries. The form of sugar consumed also plays an important role in dental caries or dental decay. Sticky carbohydrates like those found in chocolates, pastries are more dangerous than the liquid form of sugar. Numerous studies have been done in the early 19th and 20th centuries which showed that the sticky sugar consumed between meals and the higher frequency of sugar consumption are risk factors for development of dental caries. Now we will move on to dental erosion, which is another major dental condition linked to a faulty diet. This condition is rapidly increasing among the younger generation. Dental erosion is the progressive and irreversible loss of outer layers of the tooth caused by acid dissolution. While acid reflux or regurgitation and some medications can contribute to erosion, the most significant source of acid for tooth erosion is the diet. Specifically, the frequency of consumption, patterns of consumption, and time in contact with acidic food or beverages can influence tooth wear or erosion. Previous studies have also found drinks, chewable vitamin C tablets, acidic snacks, fruit juices, sour fruits increase the odds for tooth erosion. In addition, studies have also found that intake of milk and yogurt was associated with a reduction in the occurrence of erosion. So why this reduction has happened? It is because of the presence of calcium in these substances. Dental erosion may also be caused by intrinsic factors such as gastric acidity, gastric regurgitation, and among individuals who vomit frequently. Another type of similar tooth wear caused by a coarse diet and not by acidic diet is attrition. This can happen due to eating coarse raw food or betel nuts or betel quid with lime. These foods are very abrasive in nature and can wear out the tooth slowly if consumed excessively. Some of the rarer diseases that are caused by food we eat are xerostomia and oral cancer. What is xerostomia? Xerostomia, also called as a dry mouth, is caused by decreased salivation. This can be caused by frequent consumption of dry or acidic foods, caffeine, and alcohol. A dry mouth can make the oral cavity very dirty with inadequate natural clearing of the food debris. This in turn may increase the chances of decay and getting other oral infections. The consumption of tobacco too is associated with oral cancer. Numerous studies have shown that consumption of tobacco in the form of pan or gutka or any other tobacco related substances significantly increases the risk of developing oral or throat cancer as well. Now we move on to the vitamins and minerals. Our mouth and gums are the first contact point for nutrients we consume and are essential for kicking off the digestion process. In fact, according to the International Journal of Environmental Research and Public Health, the process of chewing allows us to extract the greatest possible amount of nutrients from the food we eat. Conversely, nutrient deficiencies can lead to oral conditions like inflammation and tooth loss. That means that consuming the right vitamins and minerals through food and supplements can promote healthy teeth and gums. A lack of adequate nutrients like vitamins and minerals in the early years of life can harm the development of dental hard tissues. We will now discuss the role of some of the important vitamins and minerals that are essential to oral health, primarily vitamin D, C, A, and B. Now coming to the role of vitamin D. Vitamin D plays a significant role in keeping our teeth healthy. Vitamin D deficiencies can lead to several oral health disorders like gum inflammation, cavities, and gum disease. That's because it plays a crucial role in bone and tooth mineralization. It is present in oily fish like salmon, mackerel, and herring. Additionally, some foods are vitamin D fortified like milk and breakfast cereals. Now we move on to vitamin C. Vitamin C is not only good for our teeth, it is an excellent vitamin for gums too. Vitamin C helps keep the connective tissues in our gums healthy and strong, which hold our teeth in place. You are likely getting a lot of vitamin C in your diet as it is present commonly in various citrus fruits like oranges, lemons, etc. A deficiency of vitamin C, however, can cause acute inflammation of the gums that can cause bleeding, inflammation, and ultimately the loss of teeth. It also leads to increased infections of the mouth as it decreases immunity. Now we move on to vitamin A. So vitamin A is not only good for your eyes and skin, as we all know, it is also important for our mouth, particularly for our saliva production. Saliva helps break down food and also cleans the bacteria from between our teeth. You can find vitamin A in orange-colored fruits and vegetables like carrots, sweet potatoes, bell peppers, fish, and egg. Vitamin A deficiency is associated with reduced salivary secretion. So you can have dry mouth if you have a shortage of vitamin A. Now we move on to vitamin B complex. So we all have heard of this term B complex. Why it is called a complex? Because it is made up of 8 different vitamins. That is B1, that is thiamine, B2 is riboflavin, B3 is niacin, B6 is pyridoxine, B9 is folic acid, B12 is cyanocobalamin, and also pantothenic acid and biotin. So all these vitamins are very important for not only general health, but they are also important for oral health. Vitamin B complex can help prevent irritation of inside and the outside of the mouth. These vitamins are helpful in preventing cracked lips, inflammation of the tongue, irritation inside the mouth, and gums. Vitamin B complex also helps against gum disease. A deficiency of vitamin B and its associated vitamins can lead to inflammation of the gums and the inside of the mouth, which can cause severe burning sensation. Finally, we move on to some of the important minerals that are important to oral health. Among the minerals, the most important for good oral health is calcium, in addition to phosphorus and iron. We will now have a brief discussion about calcium. Calcium isn't just good for your bones, it is good for your teeth too. According to the National Institutes of Health, calcium is one of the most important minerals in the human body, as it helps form and maintain strong bones and teeth. Dairy products like milk and yogurt have a type of calcium that's easy for our body to absorb. Fishes are also good sources of calcium. If you do not consume meat or dairy or want to add more calcium-rich vegetables to your diet, try having green leafy vegetables or nuts like almonds. Calcium deficiency, especially during childhood, can cause stunted growth generally and also stunted formation of teeth, and these teeth are more susceptible to caries or fracture. So calcium also is very, very important for maintaining the acid-base balance in the tooth. So when the environment in the mouth becomes acidic, calcium helps in maintaining the balance. Now we move on to phosphorus. Phosphorus is another essential vitamin for healthy teeth. Phosphorus can help the body absorb and use calcium and strengthens teeth by protecting and rebuilding tooth enamel. So tooth enamel is the outermost layer of the tooth, which is the hardest substance in the body. So this surface is very important as it is used for biting, chewing, etc. And also it protects the inner softer layers of the tooth. If you are looking to add more phosphorus to your diet, try to incorporate meat, milk and whole grains. Fish, eggs and protein-rich foods are also excellent sources of phosphorus. Luckily, most people get enough of this phosphorus in their regular diet without the need for dietary supplements. Next is iron. So all of us know the importance of iron for health. Iron is the important ingredient of hemoglobin, which is involved in oxygen transport in our body. However, the deficiency of iron also can cause inflammation of the mouth and tongue. In fact, the inflammation is very severe. So if the person is diagnosed with a low iron content, then iron supplements are essential. If you are maintaining a healthy and balanced diet full of whole fruits and vegetables, you are probably already consuming many of these teeth-friendly nutrients. Understanding how these nutrients impact your teeth can help your oral health in the long term. Eating healthy, unprocessed food also helps the roots of the teeth remain strong and prevent gum diseases to a large extent. As we all know, to keep a body part in active condition, we need to give it exercise. The same thing goes to the teeth also. If you are eating only soft and easy to bite, easy to chew food, then there is very less exercise for your teeth. So if we consume unprocessed food like fruits and raw vegetables, etc., then good exercise is given to the teeth also, which will keep the teeth firm in their socket. To conclude, we can say that a combination of healthy diet rich in unprocessed or partially processed foods and good oral hygiene habits can go a long way in keeping the mouth healthy. If you have any doubts, please don't hesitate to consult your dentist for timely advice. Thank you.
Dear listeners, you have just heard Dr. Shashidhar Acharya speaking on the topic Non-Nutritious Diet and Oral Health. This broadcast came to you from the studios of All India Radio Mangaluru.